रहा है साहब?
Yes. Interesting, nice video. So, good afternoon to one and all. I'm Bhakre, Event Head and Project Manager ADMH. I heartily welcome all of you in today's ADMH Healthcare Summit 2021. ADMH is the adoption of digital marketing in healthcare, a community in healthcare and wellness sector. Today's topic is digital platforms for healthcare management systems. We are thankful to our partners who supported us in today's case study, that are digital partner Innoso Digital, academic community partner ASMA, and AI partner ORI Robotics. I feel very privileged and glad to host this session. I would like to drive your attention towards a few initiatives taken under ADMH community. We as a ADMH is a community platform focused on helping healthcare professionals leverage digital for their practice and healthcare facilities. ADMH is a growing with 25,000 plus outreach as well as 6,000 plus doctors. ADMH is empowering healthcare marketers through knowledge, case studies, event and conferences, industry interactions, awards, and various other initiatives as well. ADMH stockholders may be from corporates, governments, doctors, healthcare practitioners, marketers, pharmaceutical companies, hospital administrators, government regulatory bodies, healthcare companies, solution providers, and startups. We also encourage to share your initiatives, articles, news stories, and case studies. Our editorial team will help to publish the content on ADMH portal with a wide social media, impactful reach via LinkedIn, Facebook, and Twitter. With all these spatial initiatives, ADMH is emerging as one of the most pioneer committee in helping the doctors, hospitals, and healthcare professionals. With the power of digital and social media for growth and patients' reach. So this was the brief about ADMH. The deliberation today will have a deep talk and experts' comments on various aspects related to the topic digital platforms for healthcare management systems. We are thrilled to inform that today's webinar is getting good response and participation across the country. We are glad to have your participation as a listener, speaker, and partners. Keep the interaction going on by asking the questions to the speakers in the chat box. So we are really thankful to all of you. To have a brief introduction about today's speakers, I welcome to the moderator for today's session, Mr. Kishor Gojiya. So he's a head of IT CIMS hospital. So that's it. Over to you, Kishorji.
Thank you so much, Ved Prakashji. I'm blessed and happy to be on this platform. I'm Kishor Gojiya, heading IT department in Ahmedabad, Gujarat. And today I have a few more other speakers with me. So first of all, I'm welcoming all for all this knowledge sharing platform. I just move on the next slide. The other participant on the speakers with us, we have Dr. Anupam Kumar Karmakar, CEO and MD, Hira Navneet Hospital, and we welcome you, sir, for this platform.
Welcome, sir.
Next, we have a Dr. Merlin, Varghese, Director and Administrator, BSS Hospital Research and Institute, Pune. Welcome, ma'am.
Welcome.
Thank you. Thank you.
Welcome, sir.
Yes.
Next, we have a Ankit Shah, CA for OMNI Hospitals. We welcome, sir.
Welcome, sir. Welcome.
Next, we have Mr. Suresh Nadar, CIO, Dr. Batra's group CIO. Welcome, sir.
Yeah, thank you.
Welcome, sir. Welcome, sir.
Next, we have Mr. Vishal Gupta, Advisor, National Digital Health Mission. We welcome, sir.
Good afternoon, all. Thank you.
Good afternoon, sir. Welcome, sir.
First of all, again, thank you so much for all this thing and providing us the platform to moderate this session. Thank you, ADMH. And today we are going to discuss for a few points wherein the key highlight which we are going to share on the detailing in terms of creating a more efficient, accessible and secure patient record through hospital management software, enhancing a personalized patient experience and patient care with the healthcare management system, and how digital platform foster collaborate the research in healthcare to improve a diagnosis outcomes. And last but not the least, the hospital management software can help to manage patient care beyond the hospital. So these are the few key highlights which we are going to discuss. So first of all, I will request to the panelists about the first thing which we are going to discuss, that what is their thought process in the hospital management system by keeping the patient into center. So I would like to ask and take the review from Mr. Suresh Nadar. Please give us some highlight on this.
See, actually, this clinical management system is mainly for the patient to keep the record. So by saying that itself, the system should be around the patient only. So then only the system will be, because all record keeping, everything, what we are maintaining in the system is the patient data. So it should be always say patient centric. That's what my, the information about the clinical management system.
Okay. So I would also like to invite Dr. Merlin to give an insight of creating more efficient, accessible system by keeping patient into centric.
Sir, I totally agree with sir. जैसा कि सर ने
Sir, your voice, I think, is.
Yeah, we can have the opinion for Dr. Anupam.
Some technical things.
Yes.
I moved on Dr. Anupam ji. Can you give a highlight and insight from your CFO perspective about the system accessibility and efficiency by keeping a patient in centric?
Well, thank you, Kishor. In fact, I would tell you, I'm not the CFO. Well, I'm the.
Oh, sorry. Yeah.
Yeah, and for me, of course, business is more which is required, and I have to see how I can enhance business growth, sustainability, as well as wow factor for the patient. How would I do this in the digital perspective? How? I mean, so of course, I would say the HIS is the backbone. The hospital information management system is the backbone which stores data, as Suresh has already told us in the starting. And this data would, of course, tell us the details about the patient, about the demographics, making things simpler when there is a follow-up. And there is a little lesser pain while the patient is entering for the next time to the hospital. Simultaneously, when we have a data of the patient, we are more secure. In fact, as a hospital, we are more secure that yes, we have the demographics, right patients at the right time has come for the treatment. And of course, when we enter the clinical data into that, so we have the records of the same. So we have the lineage of the treatment line, which enhances the care to the patient, and indirectly, of course, there is a wow factor for the patient. As a patient centricity that they have, the hospital is always having a data of the patient, which they can retrieve and see and do the continuity of the treatment. Is that way? Thank you.
Thank you, Dr. Anupam ji. I would like to request Mr. Ankit to give some highlight on this topic. Ankit ji, please unmute yourself.
Thank you, Mr. Kishor, and good evening, everyone. It's a pleasure having a discussion with all the eminent speakers with the domain experience. I'm leading the group of OMNI hospitals as the CFO, which operates about 800 beds and works on the compassion and patient care as the main USP, and works quite a lot on the affordability side and also on the asset light model. While HMS, I mean, we are talking about the healthcare management system, which is more as Dr. Anupam and others were also mentioning. I treat it more as a heart and soul of the entire architecture. When it comes to the entire hospital management system, whether it is online or offline, I treat it more as a complete heart and soul of the entire architecture. Now, hospital management system as a standalone might not probably optimize in terms of utilizing it with respect to patient data, with respect to research, with respect to cost optimization and all of that. So there is a lot that we need to do in terms of adding arms to hospital management system, the digital hospital management system, in terms of adding various platforms, app which can actually help improving the efficiencies of the hospital management system. So as OMNI, I mean, we have been quite committed in terms of various digital initiatives. I mean, we are quite dynamic on this when it comes to various digital initiatives. We keep evaluating the various cloud computing approaches that we can take for whether it could be a SaaS platform or the PaaS platform that is required for various applications, which can help us to improve the end user delivery, which can actually help the patient experience. And also we also try to I mean, when we talk about digital platform and with the new era, when we are talking about the cloud computing, so it has helped not just big players but also small players to optimize the entire resources that are available in terms of various platforms and various I mean innovators that we have, where we can connect this, integrate with the HMS so that the full potential can be taken out. And we as OMNI, I mean, being asset light, we try to move towards cloud computing. The reason being, it is more of use and it's more about pay and use kind of a thing, wherein you can actually, it need not be very capital intensive, but it actually helps in selecting what you want, what actually suits us at a very low cost, and then helps in the entire cost optimization. So when I keep discussing with my CIO and all that, we try to evaluate what suits us better in terms of whether to go for a SaaS or a PaaS, the PaaS platform, and how it works out. So I mean, if I have to give on various initiatives, I mean, right from probably when the demonetization started. So since then, I mean, when we started moving towards the cashless economy, so moving towards plastic cards, then the recent pandemics, we were quite dynamic enough, and thanks to the entire leadership team, we have been able to implement the telemedicine, and all of that working on partners, not developing on it on our own, because that would have taken a lot of time. So we have collaborated with a lot of partners. So we were able to successfully implemented telemedicine during the pandemic time. We had a chatbot in place. There was voice assistance that was tested and implemented. We were probably in the 2 states of South. We were probably one of the most successful players in doing the hotel quarantine and the home quarantine approach, with having remote access to patient, with all the apps that were there, and it was all quite handy. I mean, so digital has actually helped us to part through the pandemic in a very appropriate way. So it has been great. I mean, in terms of that.
Okay. Thank you so much. I would like to invite Vishal Gupta ji. Vishal ji, you are from the different altogether, like the other speakers are from the hospital or healthcare, and you are from the National Digital Health Mission, wherein government has realized to it should require to create a robust system, and now it is need of the all these era. So what is your thought process on creating more efficient, accessible, secure patient system? Vishalji, sorry, we are not able to hear you.
Kindly unmute yourself, sir.
Yes.
Can you hear me now?
Yes,
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 yes.
yes.
You can hear me, right?
Pretty
Yep.
good, right?
Okay. So thank you, Kishor. And I just want to say that, first of all, I'm not from the different segment. So I started my career with Fortis, and I was probably the first one who started the HIS in India when the Fortis was in inception stage. I'm talking about the year 1999 or 98. At that point of time, there was really any HIS who could serve the purpose of the corporate healthcare provider like Fortis. So that was a journey. So I started with Fortis, spent almost 23 years now in healthcare. So I was with Fortis, so many hospitals HIS I built and implemented in India, outside India, like Dubai, like many. Before joining NDHM, I was part of Apollo. So I was managing the North Apollo operations and the projects as a CIO for the North Apollo. There, my responsibility was to again manage the HIS and the entire IT ecosystem. So NDHM is the new thing for me recently, because that is something which I always, as a healthcare IT professional, I always wanted to do in India. So that is something very unique, very unique, which we are doing now. So I was hearing Dr. Anupam and everyone. It is really good that people now understand the value of HIS, value of EMRs, value of other stuff. But still, as I feel in a healthcare industry, still HIS is seen as a back office system. It's not seen still as a clinical information system. That is a basic thing which I want to put it here. So before I go ahead, I just want to give a quick one liner differential, because most of the time I struggle, when I give my presentations or when I talk, most of the people, they don't understand the basic terminology, the difference in the terminology. So guys, we have three things which we need to remember. One is the EMRs. Whenever I use the word EMR in the national ecosystem, that means any HIS or any system which is running for the hospital. It can be a word-based system, Excel-based system, or whatever system you want to use to manage your health records. The second term which I frequently use is the uh, EHR. EHR is the electronic health records, and the difference here is those health records are made based on the standards given by the government, given by the organization. Where I can access those health records from more than one organization based on the interoperability standard. So that is called EHR. The second thing is the PHR. The third thing is the PHR. PHR is the health records of a citizen which can be accessed by the citizen, controlled by the citizen, the way citizen wants from the various ecosystem players. For example, if I am the citizen and I want to access my health records from Fortis, from Max, from Apollo, or from AIMS, as a citizen, I should be able to do that because I own those health records based on the consent given by me. So these are the three things which we need to remember. Now, the three use cases which a nation or which any healthcare organization should build in an organization are following. First thing is, the organization should have a capability of the back office functionality, which a typical HIS system delivers. On top of that, the most important thing, as most of the players were saying, is the ability of the EMR, electronic medical record system, so that, or the ability to build a EHR functionality, so that whenever any national or any government or any big organization want to access those health record, or whenever any patient wants to access those health record based on the consent given by the patient or the government or the organization should be able to access. So that's the functionality any HIS system should deliver. So the three things which we are doing in India right now, I don't know whether most of the people are aware or not. So we have a national digital health mission. That is a flagship scheme of the government, Ministry of Health and Family Welfare. It was announced by the Honorable Prime Minister. And now the first step is that every citizen is having a kind of a health ID. It is a unique health identifier. And based on the health ID, whenever citizen goes to any of the hospitals, public hospitals or private hospitals, so the health record which are lying in this fragmented HIS system across the nation, our aim is to link those health records. So where here I am using the word link, I'm not using the word aggregate. So we are not using aggregating. We will link, and say as a citizen I should be able to fetch my health records from this various ecosystem. That's how we are trying to build. So these are the two use cases which we are trying to build. Hello.
Hello.
Am I audible?
Yes, Vishal.
Yeah, so Kishor, yeah, that just to summarize, not to take much time. So what I'm saying is any HIS system or any player in this company, be it a tech player or be it a hospital, they need to remember that HIS system should not only serve the value as a back office system, they should serve the value in the organization as a clinical information system, so that the patient can get benefits, so that the doctors can get insights, so that the CDSS, which we call the clinical decision support system, which we call the CPOE, the computerized physician order entry, such kind of things, the AIML, these related things can be delivered out of that HISM. So that should be the aim. I'm sorry, because I mean most of the organizations are still feel that HIS is a kind of a back office system to manage the patient registration, scheduling, billing, and discharge process and all. But that is hardly a 10 or 20% work which a typical CIS system should do. 80% work is the decision making, is the analytics, is the research, is really helping the business, helping the nurses, helping the doctors, paramedical staff, the radiologists, laboratories. So there are so many players who can take advantage and the benefits from the clinical information system, from a EMR system which is properly installed in any organization. Thank you.
Thank you. Yes, is the rightly shared by all the speakers that the nowadays HMIS is playing a major role, especially in healthcare segment, wherein patient record are so much important. So we can move forward and go further for the next discussion point. The point is like how we are looking as in being a healthcare service provider to enhancing and to increasing our digital and HMIS platform to increase the patient satisfaction by linking the patient, because nowadays all the HMIS legacy HMIS system are, as rightly Vishal ji shared, that it is very billing centric per se. So we have few billings modules, the reception modules, that's it, and HMIS is limited to the particular modules. So to improve the patient care and to connect the patient directly, and to enhance and to create a new patient journey to increase the patient experience, what kind of thing we should have to look at as a healthcare service provider by enhancing and implementing inside the HMI system? Mr. Suresh ji, I request you to give an insight on this point.
Yes, I can talk on that. See, ultimately this entire system is, I said that in the initial, that is for, the patient. So the patient experience is very important. See, in in the COVID time itself, lot of struggle we may, face. We went for the video consultancy, everything. Likewise, after that, what we identified was we should have a different option for the patient. We should able to connect. So likewise, now we are giving a choice to the patient. Suppose in a homeopathy, it is, our patients are almost associated with us more than 10 years, 8 years. Is that time frame the patients are with us. So our the continuous connectivity is important for us. So what we did was recently that I will give a 2-3 example, then what is my experience on with other hospital also I will share. So now we are giving a choice to the patient. Suppose today's the patient appointment is there, we are sending that SMS to the patient today, sir, in which way mode you want to come. Do you want to visit to the clinic? Do you want to VC consultation or voice? So we are giving a choice to them. Based on the choice, the data is available to the doctor. So automatically based on that option given, that we are able to connect to the patient, and the patient connectivity is happening. Likewise, we are giving a patient experience. See, ultimately the digitalization, the clinic system is stable, robust, and it's able to adapt all the things. That's the reason we are able to do this. And I want to give one more example that I want to take it. Don't take the name of the thing. Hospital name. So last week I went to my native and I want to take my father for a eye operation. So first day, 2 days before I took him, and testing everything is done. The first time the record has been created, and next time after 7 days they asked for the operation. I off the way I went 50 kilometers. I forgot to carry father's file. So I called that hospital there, sir, I forgot to carry the file. They said simply that, sir, our clinical system is that much strong. You don't need to carry anything. That is printout is for you to keep it at home. So, just give the mobile number or your patient detail, and everything is pulled out from the system. So that I felt that, wow, that such a systems are available in a village. So, that's thing. At the same time, I don't want to give the name. 8 years, my mother-in-law was, dialysis for 8 years, one of the multi-specialty hospital in Mumbai. So one day night, major heart attack. So she was admitted. Even though she was with 8 years, I went there and they are asking me the file. Where is the file? Patient file. So I said, she's with you for 8 years. No, sir, please carry that. So that itself shows, they don't have the digital system that much, that the customer was, as a patient, was not satisfied. So here what I'm trying to say is, until unless that strong in a digital environment, if the backbone system is not in the hospital, the patient will not be happy. I mean, they cannot carry that data. They trust you. They are thinking that all the data is with you. Whenever they come, you should know my history and you should serve me. So such as is a expectation from the customer, that will give a wow experience, customer satisfaction. Everything will fall under that. If the system is in place, you can give it. Otherwise, no. That's what my view on that. Thank you.
Yes, absolutely correct, Sureshji. Because nowadays there are patients are so techno savvy. In fact, 60-year-old or 65-year-old patient are used to operate WhatsApp and Facebook on their mobile.
Correct.
They are demanding all their report on their mobile.
Yeah.
So they said, we don't want print out. If you can send it me on my WhatsApp, it will be easy for me. Correct. So that is the patient need. I move forward. I'll come with you, Sureshji. I'll move forward with Dr. Anupam ji. Sir, what is your key insight? Being a CEO and MD of the organization, what kind of strategy you are driving for the enhancing the patient experience through the digital journey?
Well, it's a very good interaction. In fact, I've heard Vishal ji, Suresh ji, and of course Ankit ji was speaking about a lot of digitization work. And trust me, in fact, it's actually the digital world which should work. And people are understanding that this is the time when digitization is actually working and helping individuals wherever they are. In fact, an amazing experience shared by Suresh ji, that a village is adapting, okay, and a city is not adapting. Well, the question there is of the adaptability of people. I don't know, I mean, say, when will people understand that, look, I mean, say, everything is there right now, everything is digitized, you have to carry this thing. So if you ask me about the patient satisfaction and how we should achieve the same, it is right from beginning, even the patient enters your organization. Okay. And you have to get into the patients to tell that what exactly you have. Once the patient enters, you have to have each and every area a kind of kind of a kiosk or kind of something which will basically help the patient to complete things in quick ways. For example, one of my previous organizations, we had a kiosk right at the admission desk, Okay, later on we enhanced that. We did the admission and the registration form right in the website. So even if the patient before entering the hospital, can fill up the form and bring it to the hospital, and the things can be faster. In fact, one more step forward, if they fill up the form in the website, it can directly get reflected on the system, which is integrated with the admission desk, and the patient just have to tell the name and give an identification proof, and that's it. So how smoothness, I mean, that lesser the time, even that goes one step ahead. When they go for the initial assessment and everything, blah, 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 the papers and everything is already ready for the patient and is ready for welcoming the patient in the ward, right? If the patient is for a planned surgery or something else, if the patient is even in the ICU, it goes very seamlessly. All right, these things actually, see the time is very important for any patient. And if it is faster it hits the mind of the patient and the relatives that, wow, it's happening so quickly. Yes, they have all the details well in advance, well in hand. Okay. Similarly, websites, when integrated, they give an updation of the patient's like billing. Thing is been updated. The lab results have been updated by giving them a small, username and a password while they are admitted in the hospital or something of that sort. Even while that's while still in the hospital, when the patient is gone, okay, the continuity is still more. In fact, why the continuity is still more? It's the after effect. See, it's like simple. I mean, I would want to make it simple. It's after you go home, the care which is given through digitization also affects a lot. In fact, if there is a message going to the patient, then how is the health of the patient? If there is some certain reminders given that, look, your follow-up is there. Look, your you need to this doctor, you have this diet. I hope you are following it. And these kind of things, actually, what is the people want? Actually, this is what the people want, and which attains the kind of a wow for the patient. And of course, the other way around, if you say the clinicians would say that, look, I want to see the data of the patient which was there, I mean, say 2 years back. Then he can go back and see. There is facts, picture assisted computerized things, and those things which is already there. Results are out there. For the clinicians also, it's something that, yes, I have the trail of the treatment, and that is something good even for the clinician. For me, of course, I see the business. I see what is I work in a charitable hospital right now. So business is, of course, there is business, which is important. But of course, I want to treat every patient who's coming at my doors. I see the data of the people who are there. I mean, what kind of patients are there in the general ward? What kind of patients are there in the multi-bedded rooms or single rooms or something of that sort? And I basically have an analysis that which is my bed, which is being used more. I think so. Of course, all the panelists, including Ankit sir, would understand more what I'm speaking, because we think business. Like I mean, we want to know which bed is earning me for more. And of course, with the patient's wow factor, with the doctor's wow factor, even the administrator should feel wow. Right? Thank you.
Yeah. So interesting insight from the business perspective by keeping the patient into centric. So I would like to request Mr. Ankit ji, why don't you give some crisp about from the CFO platform, wherein what is your insight in terms of financial thing, in terms of how we can enhance and increase the patient experience by providing a various facility.
Sure. I think it will be a mix of finance and clinical. So yeah, I mean, it has been a lot of learning, and I'm quite happy to interact with Mr. Vishal Gupta as well, because I've been following NDHM quite with a lot of excitement actually. I've been following it for a while, since it got launched on 15th August by the Honorable Prime Minister. So as Mr. Suresh were mentioning about the experience of the village, which I'm sure is also the idea of NDHM, is to reduce the gap between the urban and the rural, which it's going to reduce the gap, and it's something excited to see about. When it comes to, more from the finance point of view, there are a lot of things which earlier were voluntary, like the entire healthcare IT that we are looking today as a voluntary this thing, which helps the organization. Now is slowly getting into mandatory as well. If you look at the e-invoicing part, so while we are planning to have digitalization as a voluntary this thing, now if you look at thresholds of revenue based on that, now it is mandatory to generate e-invoices, which again need to sync with your HMS, and you need to be prepared for this. So and including with the QR code and all of that. So now the whole regulatory environment is also moving in a way where we now need to get digitalized as a mandate as well. And slowly this is going to get, as we move forward, the data analytics from the HMS will slowly start moving to regulatory bodies as well. So the when I see the vision of NDHM, which Mr. Vishal Gupta can probably elaborate more on, that is the various parameters where the HMS will slowly get in sync with also the national health data. And because there are so many things in the vision document that shows where a lot of things will get mandatory for us to share with the and it will not just be a voluntary digitalization. So while all this happens, we actually need to get geared up to ensure that the HMS is digitalized as well. So more from the aspect of the finance. While that is there, all the data points, as Dr. Anupam was saying, all of that, where it is quite important for us to analyze the data, both in terms of optimizing and seeing which variables are doing well, which variables are lagging, and which requires correction. So with healthcare systems, there is a lot of leakage in the system because you have so many variables, right? From pharmacy, diagnostic, lab, you have consumables, you have doctors, you have the billing system. If the billing is not appropriate, you end up with so much of losses. So with so many variables, I don't think any industry will have so many variables which are quite discrete to each other. So the whole digitalization, I think, is something that the healthcare system deserves, which needs to be geared up to ensure that we are the end user gets healthcare at nominal prices. So and we as OMNI, we have always worked on the affordability side, and also ensure that every saving, whatever you make, ultimately goes to the end user. So that is quite important, and all the investment that we'll do in digital healthcare will ultimately add value to the patient.
True. Ankit ji, it is a fantastic things that every saving will always travel and affect to the end user. That is the most important. As in being an platform service provider or being a service provider, we should have to take care the implementation and the innovation should be a cost effective. So it may not be create a more burden towards the patient. So I'll request to Vishal ji. Vishal ji, can you please give us some insight in terms of while we are talking about system and accessibility? While we announce that system should be accessible and easy to access from the each and every perspective, what kind of key insight we should have to take care while we are implementing policy and procedure by keeping patient experience into center? Yes, Vishal ji.
Hello, you can hear me, right?
Yep.
So what I'm saying is the first problem is we don't have MDs and CEO like Dr. Anupam in most of the hospital. That is a problem number one. Problem number two is we don't have the CFO like Mr. Ankit in most of the hospitals. That is a major problem. So most of the CEO, most of the CFO treat back to manage their operations mainly counters. When it comes to the patient experience, they give time, but they still, the value of the EMR, they don't want to spend any money on that. In India, there are very few HIS or very few EMR solutions which have a very good patient experience, enabled components. And the third problem is, even the first one, like let's assume we have CEO and MDs like Dr. Anupam and the CFO like Dr. Ankit in most of the hospitals, but we don't have the good healthcare practitioner. When I say good, means the clinician or the nurses who really have to use the HIS system or the clinical system. The adoption is a major challenge here. People still feel that HIS, if you ask them to write any entry in the HIS system, they feel it is like going to the moon. It is as difficult as going to the moon still. So here is the innovation comes. Like innovation means, as a IT person, we can bring those innovations to the end user. When I say end user, means the doctor, so that they feel, that the system is easy. It is saving their time rather than extra burden. So the doctor, they should start entering which we call the point of source systems. Then only you will get any insight. Then only you will get a patient experience. That is a problem. Now, answering Mr. Ankit's question. So as a nation, we recognized, the government of India recognized this issue, and we are creating so many solutions. So the first one is we call the NDHM Health Record app. So NDHM Health Record app is right now available on the Google. Every citizen of India should download that. By using this app, what you can do is you can go to the various hospitals, public hospitals and private hospitals, and you can provide your consent to access the digital health records which are generated in those hospitals. That is point number one. Point number two, you can access all the health records which are lying in the different hospitals. Let's say you have few health records in Fortis, Max, Apollo, and whatever. So what you can do is, by click, you can fetch all your health records from the various healthcare institutes. Or maybe if you want, you can fetch your health records from the laboratories, from the diagnostic labs, and so on. The third is you want to exchange those health records. Let's say I'm a patient going to the hospital A with the Dr. X, and now I want to go to the hospital B with Dr. Y. So I authorize hospital B and Dr. Y to access my health records generated by Dr. X using the PHR app of the government. So I can provide my consent. Okay, you go and access my health record which are lying in this hospital. So the use case, as one of the CIO, I think, just shared the physical. So these cases very soon we want to at least in India, to see as a history. So we are creating a very, very innovative solution here. Like in most of the Western countries, what you will see, the EMR, they are aggregating in any specialized repository, which we typically call the EHR repository. But in India, we are not creating any repository of the health records. So health records would be available on the fly. As a citizen, whenever and whatever health records I want, I should be able to fetch directly from the source. When I say directly from the source, means directly from the hospitals where the health records was. That happen. One thing to share. Recently, as most of the people would know, that this National Digital Health Mission is the pilot phase is already live in 6 UTs. And the citizens of these 6 UTs, they are very happy. They are exchanging their health record digitally. And yesterday, someone was telling me use cases from Ladakh. There is a hospital in Ladakh, and that hospital is completely digital hospital now. And the patient came to Delhi, and the patient was in one of the very known hospital of Delhi, and he opened that PHR app, and then he was showing the health record which were lying in the Ladakh, and the doctor in the Delhi, he was amazed to see that. So that kind of digital transformation is moving. Just this matter of few, I'm not saying years, and then we will see the reality. So that is my submission.
Thank you so much, Vishalji. I think Dr. Merlin is also been with us. So if Dr. Merlin is been with us, I request him to please be online and switch on the audio and video so we can ask them to share more insight from them side. Dr. Merlin been with us or not? Okay. So yes, it is a wonderful discussion in terms of to keeping patient experience in a centric, how we can enhance and increase our patient experience by implementing and keeping our the HMI system onto next level. So we all knows that there are so many players are into market who providing the solution, who provide the software solution, EMR solution, and so many things and so on forth. How many service provider are keeping all these platform into a single level wherein we can get the exact detail? We are not in terms of most of the HMI system are entering garbage data, so we are getting garbage out. So most of the healthcare provider didn't have that much of data where they can do analysis, they can do a research, they can publish the papers. Just because of that, each and everyone have their own practice, each and everyone have their own philosophy to utilize the product. And nowadays there are n number of service provider available in the market and they are not following any standard. Yes, of course, few GDPR, HIPAA compliance are still there into market, but the service provider are providing the plain vanilla box, and the healthcare service provider are adding so many of topping it on top of that. So what kind of thing which need to be take care to creating a single platform wherein we get a good healthy data and can utilize the data for research purpose or for better patient clinical outcomes? Yes, Mr. Suresh.
Yeah.
Kishor, can I answer this question if you don't mind?
Yeah. Please.
Okay. So, this is something which, the initiative the government is doing. So most of the people will not know that there is something called NRC, the National Resource Center. So I would request everyone to search CDAC National Resource Center and just see the guidelines, the healthcare guidelines published by the CDAC. So Ministry of Health has appointed CDAC as a body to establish the healthcare standards. So they launched in 2016, which they call EHR standards guidelines, and the Ministry of Health has again asked CDAC to publish the new guidelines. But if you go and see guidelines, which is NDHM guidelines for any healthcare organization, when I say any healthcare organization means any healthcare providers as well as the technical service providers. So they have published guidelines. And those guidelines covers the standards, interoperability, whether what kind of resources you need to use in terms of the fire resources, HL7 resources, what kind of versions you need to use, what should be the metadata format. Each and every component the CDAC people has made published. There are so many healthcare companies, healthcare organization, big organization, as well as the tech providers, they are using those guidelines and they are publishing or they are developing their systems. So just for the sake of knowledge, I thought to share.
Yeah, sure. Thank you so much. So again, I come to Mr. Suresh. Mr.
Yeah.
Suresh ji, can you give some more highlight in terms of what kind of standardization you have did in your organization?
Yeah, actually, we were looking for multiple service provider for my, for my organization. Unfortunately, none of, as you said rightly, that, different people will have a different solution, but it doesn't suits my organization. What I did was, I did it in-house development for all the models, because there are, several reasons. The changes are coming inside my organizations are more. If I go to that, external system, the, vanilla system will not work. That's the reason we took a decision that, the 5 years before, we should have an internal team to develop, because what is needed for us can be fulfilled. That's the way the decision has been taken. Based on that, the three key values, based considering that, as Mr. Vishal has rightly said, that the CDAC is having that some, key guidelines and all. So we are having our internal guidelines in our, whenever I am taking any initiative, I have to solve three problems. One is ease of operation to the doctors, because he's the one going to capturing the data and do that. So that is the first. It should be a ease of operations. Second, it should give a wow. It should capture all the data and give a wow experience to the patients. Third, it should capture all the data where the business has to take a decision on available data. If the three is not possible by in a single vendor and integrating with multiple system. So in our system, all in-house. That's the reason I'm able to achieve all the points, whatever I talk about, that wow experience, ease of operation, and what is needed for the business to move ahead to the next stage. How to give a patient experience, cure case, lot of things. I mean, it's not possible to develop through external system. That's the reason I take a decision to do it internally, and it is solving my all 3 points, I mean, purpose. So that's what my bunch of operation we asked that I went in, I started developing internal only. Thank you.
Sure. Okay, thank you. So I go with the Dr. Anupam. Sir, what is your key insight for this? Sir, you are mute. Sir, please unmute yourself.
So yeah, taking forward the words of Suresh ji is very much right. That all the three aspects have to be covered. And of course, when you say for a CEO and MD of an institute, I would of course again look into the aspect that what is the ease. So selecting a software, HMS software, sometimes is like wine. You have to develop the taste for it, or else you don't like it. And you have so many wines in our fraternity that there is so many softwares. Some will give you this, some will give you that. Simultaneously also, see, I've been handling hospitals of strength of 1,500 to the minimum of maybe 100 beds. So the 1,500 is of course a university hospital. The requirement is a different one. And when I say normal hospital of say around about 300 plus bedded hospital, which is not a university, the requirement over there is different. Finally, again over there is a bifurcation. Is it a charitable hospital or is it a private hospital? Again, the requirement is different. So you have to go with the organization. So the challenge for us and the CIOs and the CFOs is very simple. Whichever the organization they are going in for, and the vision mission of the organization should actually suffice the hospital management information system. And of course, at the end of the day, your EBITDA has to be maintained properly if you're in a private organization. And secondly, your patient satisfaction and your charity work, your CSR activities should be satisfied when you're in a charitable organization or so on and so forth. I would say kind of whichever hospital information management system you're going for, it should be a little user friendly. Okay. And before going to that, it should be very much like the training should be given. Main is the training. I would say the lack of training sometimes is a problematic situation which can be solved, but because of the training not given, you are wasting of your time. Your things are being, just gone haywire. And then of course, when somebody comes in the picture and says, "Oh my God, you have so many features. Why don't you give those to us?" That time they say, "Sir, किसी ने मांगा ही नहीं तो क्या देंगे?" So basically, the person who is taking the system, who should know exactly what are the features, how the training is to be imparted to the person, and of course, you have to see the staff to whom the training is being given. Then it is the completion of 360 degrees, completion of that work. Simultaneously, yes, I would say that your staff should have a very, very good adaptability of the system. And of course, the rest of the game is your CIO. Simple. Thank you.
Yes. So thank you so much. Now question to Ankit ji. Ankit ji, the system always required to invest a cost into it. While we are talking about the research part, while we are talking about customization part, while we are talking about new in-house development part, that always cost factor will be always concern, key highlighted discussion topic for the IT guys. So what is your key insight for that CFO perspective?
Just to get the question right, you are asking more from the development point of view, right?
Yes.
See, I think it is very subjective. I mean, depending on the use and longevity. If we are trying to evaluate something new, I mean, if it's a regular HMS, which is required per se for the system, I think we can go for development. In case if we have that kind of funds and we have that kind of longevity as a vision. I mean, if you are not looking for something, I mean, if you are sitting with a private equity funds or something, you need to ensure that your returns come early. While if you are something where the expectations are that we can generate returns over 8 years, 10 years, I think then the perspective is different. And if you are working on something very dynamic, which probably changes quite frequently, so then that is something, that is one factor that we have to look at. The other thing is, while development is one thing, I mean, if the team has confidence on the development, this thing where the sustainability, the maintenance, which also we need to have confidence, and whether the team will also be with the entire development and implementation part. So all these factors, I think, will have to be taken care in, which I believe a lot of things. I mean, while I agree with Mr. Suresh's thought, a lot of things are, I mean, on these fronts are quite challenging to get all the things in place. So, I mean, when you ask me, I would still believe that I would still leave it on the best man to do the best job. Which, if someone has done a development and it developed a product, which either as a SaaS platform or the PaaS platform, which suits me, and if it is light on my pocket, which ultimately I can keep the tariffs for the customers, patients also quite low. So I would go for something that actually, as I mentioned, something that helps the end user ultimately.
Okay. So I think Dr. Merlin has been with us. Dr. Merlin, are you there? Okay. So we'll move forward. As Vishal ji has already shared few insights. Vishal ji, any comment from your side for this digital transformation by considering the research and the diagnosis outcome basis? Any other comment from your side? Okay. So going to move further for the another discussion, because nowadays due to pandemic has taught us so many new things and give us a freedom to adopting a new technology. In fact, most of the clinician practitioner has adopted this technology, and the new generation, the patient is so techno savvy. They are demanding their data on their device, and they are also asking the care at their doorstep. So the next point is how it will be a technology beneficial towards the hospital healthcare service provider by giving them a care on their doorstep, to give us a facility on their doorstep to the patient and give them a appropriate care with the standard practice. So how technology will help them to give them a best care on their doorstep? Yes, Suresh.
Yeah. So here I want to tell that, during the COVID, I mean, entire things, you are aware of that the home, we are having a clinic across globe, and, the patient has to come to our clinic, and the case has to be taken, and treatment has to be started, and the medicine has to be given. This is the model we used. The entire almost 6 months. So then the entire model has been changed because of the digitization. I mean, because of this technology. So patients are not ready to come to the clinic because of that, the virus. What we did was a video conferencing model was already there. We enhanced immediately within a week, whereby, it's like a seamless. They are sitting in the home, and like a clinic, they are there. That's a, type of model we developed in-house with my team. And that worked for us 6 months. There is no business law, the same business I got. Suppose per day 500 patients were supposed to visit. The same 500 visitors happened through digitization. That time the courier was a major problem. How you even, you discuss with that, all the cases taken, how to deliver it. We have arranged a, courier system, courier company, since it is emergency, we deliver a medicine on the same day and next day, because our clinics are available in all cities. So, remote city also, tier 2 also, we are able to send it through, our in-house staff or arrange the people from outside. We got a e-pass, everything, it's like digital technology helped us, and for seamless operation. So that's what I am saying, that digital will always help in doing that situation, always helping us for our growth.
Okay, thank you, Suresh. So I request you, Dr. Anupam ji, can you please give me a key highlight in terms of during this, especially in pandemic time, what kind of digitalization help you to drive the business?
Well, I was at a little transit at this moment, to be very honest. Recently joined this organization. Before that, I was a part of the BKC COVID hospital, which was commissioned 1,034 beds. So, well, if you ask me, of course, my colleagues and all, what has happened during this pandemic is, of course, a lot of video conferencing was happened. I mean, the people have gone into that depth using the technology, understanding that, I mean, at their doorstep, they could be, but that was, of course, the people who could afford doing it, or knowing that yes, you can digitally also connect to the doctor and all. But of course, what was the condition of the people who does not use technology? I mean, say they were a little deprived of the same situation. And yes, I mean, say before this, I was in a tier 2 city in a remote area, making up the, a different center. So I was just thinking, I mean, say, how about them people to connect to the people in the hospital, connect to the doctor and all. So it is indeed kind of a situation which everybody has faced. And yes, it's a very simple method to kind of, reaching them to their houses, to their mobile phones, to understand them, talking to the doctor, that doc, look, I'm having this kind of an issue here, having this kind of problem. What should I do? What should I be taking care of? Look, there's a temperature of my child going up and down, and what things to be done. So, of course, the doctors use this digitization platform and did come up with a lot of solutions to the people who actually couldn't reach the hospitals or any HCOs, healthcare organizations. Simultaneously, technology, of course, obviously that's pandemic kind of situation. But if not a pandemic situation, then how does technology, like how does digitization of, I mean, there is so many things. Like I started with, I mean, filling up the registration form. I go to the basics, the mere basics, which of course, I mean, people sometimes leave over. But yes, it is very true. I mean, getting hands off to the to the patient, that they know that, look, I'm going to see all this. I'm making the patient aware through my website, through my through my website, that, look, I mean, this you are going to experience before the admission, during the admission, and after the admission. This is what you're going to experience when you're going to discharge. This is the time being required. If I give these things to the patient well in advance, the time frame, the patient's mentality then remains little calm, that, look, I know this is going to happen, this is happening, and I will be released from the organization at this much time. Number one. Number two is, of course, there are so many gateways, in fact, payment gateways. For example, I mean, say if the patient do not want to, reach to the hospital, even for the, this this video conferencing, they can give their amount by the, the payment gateways, wherein you tie up with the bank and the bank gives you some payment, which link is there on your website, and through that they immediately pay it off, and then after you are released. In fact. So there is, of course, you have to know these things. So I would take a little step ahead, not from the HIMS systems, but we were trying to club these things. I hope that is clubbed till now. When I was in a jumbo COVID center, in fact, handling the whole patient, we had, like, of course, nobody could go inside, but yes, we wanted to monitor. What we did, there was a full CCTV coverage, and there was a command control center for the doctors. The doctors could see the patients very, very clearly that kya ho raha hai us patient ke andar. It was that way. And this was immediately reported. Kisi that patient coughing. That patient is not looking good. What is the problem? So the person inside who is in the PP case, okay, he can answer that, look, this is the condition of patient, this is it. So this is like, and then after this, integrating this with the HIS system, that for this kind of patient, when he was there, the whole video was there. So, tomorrow there is nobody could pinpoint that, look, my patient was not taken care of. So this is a little step towards enhancement. I mean, see, there is, you are IT guys, Kishor ji and Suresh ji are IT guys. Of course, Ankit ji is a money man. He will give money to you guys, but you all can do anything. Like, I mean, I'm kind of IT guys can, they can do a lot of things. In fact, you guys give us the motivation, and you guys make us feel so good. In fact, of course, even Vishal ji, of course, how can I forget him? You guys like really tell us that, look, this can happen just at a click of a pen, and make our life as seniors or organizations so simple. So simple, I mean, it's very true. We know that, look, how we go ahead, how we should move ahead, and how we should strategize performance, how we should strategize the situation, what we should see down the line 5 years, 10 years, and that's it. So that's my submission. Thank you so much.
Yes, Anupam ji, rightly you said that the digitalization help a lot to organization to enhancing and increasing patient experience. If I can share with you one small example of my hospital. During the pandemic, on the second day or third day, we got a intimation that we want to screen each and every person who is coming inside the hospital. And we want a digitalization, because we cannot use paper pen, by asking them a few questions that whether you have a travel history or not, what is your temperature, what is your history, and where you are coming from. So all these things we require to convert into digital. And believe us, with the help of technology, within a 3 days time, we come up with the barcode based solution wherein the visitor, doctor or patient or staff, all they have to just scan the barcode from their device. They have to fill up the details. System will automatically give them an intimation whether you want to go through the scanning protocol, or where you have to go through the detailed scanning protocol by visiting the different area. So a system will trigger them. And once system will trigger, automatically system will trigger the another team that this many of peoples and this many of bunch of group are coming for the scanning. So be prepared, be vigilant, and be ready for this all this screening protocol and all. So system will help a lot, and especially during the pandemic, the organization has adopted a lot many of technology. But of course, Ankit ji, we want to hear from you for the related to that. What is your think? How important digital platform healthcare for the CFO perspective?
Yeah, I mean, with respect to during the pandemic time, I mean, we were again quite proactive with starting the hotel quarantine and home quarantine, which was done within a week's time, and with various, tie-ups, having various partners, which also included the video conferencing. So as Dr. Suresh was also mentioning on the telemedicine part. So again, I mean, in telemedicine, you have synchronous and asynchronous part. So when it's between two people, it was more synchronous. So we opted for the synchronous video conferencing during the pandemic with for the hotel quarantine and home quarantine. So that helped us in two ways. One is while hospital was busy treating lot of critical patients, because it was not that you had lot of manpower even at hospitals. because these were the resources had to be used for more critical patients. And you can't use it just for someone who is having a fever or just someone who needs to be quarantined, because the resource was quite scarce. And on the other side, you can't say no to the patient. Reason being, these are patients who have been loyal to you, and you need to cater. I mean, it was more like a service that the healthcare industry had to do. So that was the time when we came up with, we evaluated the whole hotel quarantine and home quarantine model, whether it will be feasible or not, what should be the pricing and all that. And believe me, we did at 20% cost of the hospital cost for the hotel quarantine and home quarantine, which included their entire treatment. They included their entire treatment, monitoring, video conferencing, medical medicines being delivered to their house. The entire this thing was evaluated, worked out, and executed with complete healthcare backup, with complete patient satisfaction. Now these patients, I mean, when they ended up calling our hospitals, they were quite worried as well, because the hospital bills, what you read in the newspapers, were going up. So they were like, probably I might be admitted and all that. So we told them, you don't need to actually get admitted. You just need to be quarantined. And those who could get home quarantine, we advised home quarantine. For hotel quarantine, it was like, if someone is elderly at their home where you can't do a hotel quarantine, then where home quarantine was not possible. So hotel quarantine, again, we implemented the video conferencing along with the payment gateway part, what you have mentioned, which Dr. Anupam was mentioning. So where it has helped them for seamless payments, and again, contactless payments, which has helped quite a lot. So, I mean, overall, with respect to evaluation and implementation, it has helped, again, because of these IT partners being available. And the key was, with the IT team, was quick implementation, integration, and see that it goes seamless for the patient experience.
Yes, yes. So all the technology always depend on the implementation and adaptability. Because if we implement on right time, and we train them people to use the application, and they adopt the technology, then definitely they're going to be a huge impact on the business as well as on the patient experience also. So Vishalji, a comment from your side. What is the key insight in terms of by publishing, by coming up with the new rules and regulation for healthcare service provider to adopting the digital platform and following the policy and process? Yes, Vishalji.
Hello.
Yes, you're audible.
Oh, so I was talking. Sorry. So what I'm saying is, so the term which we people should download the guidelines, which is HIP and HIU guidelines. And HIP, just to set the context, is the health information provider. So health information providers are the typical hospitals, and HIUs are the typically, again, the anyone who use that information, be a patient, be a doctor, be a hospital, any research agencies, any government or private institutes. So the guidelines, that includes the standards, that includes the framework, that includes the interoperability, that includes the fire profiles. So everything is included there. So I would strongly recommend that. I mean, I cannot explain on the call that what are the standards of, which is from the government. So people should go there and download that.
Okay. So yes, as we discussed today, there are so many few key important things, like how digital platform help us a lot by enhancing the patient experience to reaching the patient at their doorstep. And of course, yes, digital always help us to handle the pandemic, no matter whether it is a COVID or whether it is any requirement or whether it is a new business setup. Yes, of course, healthcare service provider always adopt the new technology which give them a new freedom, new enhance, new skills and new power for their own hand. So considering all these things, I would like to all the speakers to give a few crisp and the closing remark on the digital platform for the healthcare management system. So I'll go with the Dr. Suresh ji. Yes.
I already explained that any clinical management system should solve three problems: ease of operation, wow experience, and it should all the data should help the business to grow. So if these three are fulfilled, we should go ahead, and this is what requirement. That's what my point clear.
Fantastic, Suresh ji. Yes, Anupam ji.
Great. It was a great interaction with all of you, in fact, in this platform. Well, my say for this would be that yes, HMS system is the backbone of any HCO, healthcare organization, and it is for everybody. It's not only for the patients alone, it's not only for the staff alone, it's not only for the hospital alone, it is not only for the doctors. It is for everybody, and everybody has to take part in it. And everybody is equally responsible for that. Thank you so much.
Thank you, Anupam ji. Yes, Ankit ji.
Yeah, I think from my side, it would be that it's again, digital is something, it goes as a perception. Probably it's more for larger corporates, which I don't, which I think even right from a nursing home to a bigger, larger corporates, everyone needs to focus on this. And there are a lot of products available in the market, which just requires someone to keenly evaluate and look at it, and then try to evaluate whether what suits them and what is feasible. And it should not be that it should not I think healthcare per se has always been little away from digital. I mean, and that is how it has been. Now I think it's time that people should get more digital pro.
Thank you, Ankit ji. Any closing remark, Vishal ji, from your side? Vishal ji, I think you are mute.
Yeah, you can hear me.
Yes, Vishal.
Yeah. So as already covered by everyone, I mean, especially Dr. Anupam. So the IT should not only cover the part of automation, or like the prospect should be like the patient-centric workflows, the things which can enable the patients and the doctors and the clinician to make use of the information, gather the information in a meaningful way, should be the priority of any organization, especially the priority of any IT team in the organization. So IT team should work as a bridge between the organization as well as the stakeholders. When I say stakeholders, mean the patients, like the doctors, like the nurses. So the typical IT team, the problem is they sit in their IT cubicles, and then they are responsible for managing the laptops, data centers, firewalls and all, and then they feel that is their job. I strongly believe that these kind of work, like managing help desk, like managing data centers, like managing applications, can be managed anyone who is not in your IT team. It can be managed very easily by the outsource vendor. It can be managed very easily by the any service provider which you easily get from the market. A typical IT team job should be sit with the stakeholders, sit with the finance, sit with the nursing, sit with the radiology department, and then get what they want to achieve. Spend some time on the billing counter, spend some time on the registration counter, interact with the patient, feel how they are struggling to get the information, feel how much time they are getting when the patient, when your discharge people are discharging the patient, when your admission people are taking admissions. So what are the hurdles there? Just try to solve those hurdles through the small solution, small innovation, small steps which you can achieve from your existing HA solution. So that should be my advice.
Yes, it is very true, and we are the CIMS hospital is the best example of the same fundamental theory, because apart from the HMIS system, we used to sit with the user, we understand the requirement, and nowadays we have a 80+ module which are the apart from the HMI system, which we have developed internally to fulfill the user requirement, which they are on the paper-based system and they are facing so many of hurdles, and we have converted into digital platform. So that is a very key highlight, that once we go with the user, once we sit with them, once we understand their need, we can give them a best system which will be give us a drastical result in terms of adopting the digital platform. And I must say thank you so much ADMH for the providing us such a huge platform wherein CFO, CEO, IT and the regulatory bodies are all together on the single platform and discussed so many parameters which will be useful for the all the technology leaders as well as the healthcare service providers for the same. I again always thankful for the all the service providers and the partners, and thank you so much for the all the eminent speakers, and over to Ved Prakash.
Yeah, thanks a lot, Kishorji. So coming to the closing ceremony of today's session, just to bring in a perspective of ADMH again, the mission under which we have organized this particular session. So I request your patronage, and I seek the support from all the members here, all the audience here attending the session, to join the ADMH group. The whole pursuit are to drive the ADMH healthcare marketing and to drive its dimensions. Thank you so much, all the panelists, to join over here. Each has been a great resource today. So it has been a very insightful sessions today. Special thanks to Dr. Anupam Karmakar, sir. Thank you so much, sir. Mr. Suresh Nadar, sir, thank you so much. Mr. Vishal Gupta, sir, thank you so much, sir. Mr. Ankit Shah, thank you so much. And unfortunately, Dr. Merlin Varghese, she couldn't join due to some technical issues. But thank you so much, Merlin ma'am. And thank you so much, Kishorji, who had moderated the sessions very nicely. And yes, a big thanks to our audience. So we will be coming with a wonderful topic with the health and wellness in April month. Again, with a new set of new eminent speakers and experts. So please stay tuned to ADMH social media handles of LinkedIn, Facebook, and Twitter to get the latest updates. And for those who have missed to attend this session, they can see the live video on Facebook or ADMH and YouTube. So it was such a great thing being together and learn and undergo the different aspects. So once again, thank you so much for attending the session. A big salute to all of you over here. Stay safe, stay home. Bye-bye.